Um, we have then our colleague from Health Canada in Ottawa, Hripsime. Can you please?
Hello, everyone. Thank you very much, Beat, for invitation again this year. It's nice to be here on this special year, number 10. Looking forward to another 10. Okay, so my presentation is mainly going to go over the regulatory, which screen? This screen? This one? Okay, so Health Canada regulates many products, drugs, devices, natural health products. We look at also food and biological products. So Health Canada, in a sense, has one act, Food and Drugs Act. However, the act has many regulations that are specific to the products that we regulate. Our regulatory system is working well so far, and we don't have many issues at the point. However, anytime when a new technology comes in this case nanotechnology, we always look at available material, which is obviously we're all struggling with, considering guidances, standards, and so on. However, we feel that our regulations seem to be satisfactory at the time. Some of the important things that we have done, we feel, was coming up with kind of a generic definition for a nano. And this was kind of a starting point for us in order to be able to identify whether a certain product was a nano or not. And we also established a number of working groups at different levels of government in order to be able to discuss and agree on certain points and how to approach some of these new products that are coming to the market. Health Products and Food Branch, which I'm from, is responsible for regulating health products and food. So we have a number of directorates in our branch which look for specific product category. So as you can see, Biologics and Genetics, Food Directorate, Marketed Health Products Directorate, Natural Products, Health Products, Therapeutic Products Directorate, where I'm from, and Veterinary Drugs. Now, each directorate is looking at specific set of products, and I would like to introduce my colleague Michael Johnson, who is from Bureau of Biologics and responsible for some of the research work that is being done. And this year, Michael is chairing our IPRF working group, so we're very glad that Health Canada is contributing to international work. So some of the other directorates also are looking after certain products, and Therapeutic Products is looking after both drugs and devices. So we have created a web page in order to have one common place where companies could sort of come to us and see that if their product contains nano in any form, then we need to be discussing this beforehand, before they provide a full submission for review. And our application forms for drugs, devices, natural health products have been revised to add one point there, which is whether or not that product contains a nano. And this started on volunteer basis, but more and more these fields are being populated by the companies as they come to us. And this is one way of indicating whether a certain product, based on manufacturer's interpretation, of course, would be considered nano or not. Now, with any innovation and new technologies, of course, we have challenges. And emerging technology presents unique challenges and opportunities at the same time. And we try to base our decisions on best available science and collaboration with our international partners to make sure that we're using all available science and best practices. And as now technology evolves, so do the products, and slowly we do see some submissions coming forward, but mainly at clinical trial stages. So we haven't had any specific ones other than sunscreen lotions and some dental implants perhaps. And we do work closely with both our home-based government organizations, provinces, and local agencies, and our international partners at the same time. We try to collaborate wherever possible, and last year, Nano Canada was established in order to have some kind of a national nano program. It is mainly created by the provinces and doesn't have a federal jurisdiction at this point, but the aim is to come up with one national strategy for nanotechnology, and the website is available there. Of course, we collaborate with our international partners. We participate in ISO 229 working group, number of working groups to at least provide the government's regulators interest in developing these standards. Some of them are too technical and not easily related to the products that we're reviewing, and it would be nice if there was a better communication and work with any standardization organization. We work with OECD organization. We have a number of colleagues from our environmental side of the regulators that are working very intensely with them and collaborating in research as well. We're part of Canada-US Regulatory Cooperation Council, which is currently collaborating on nano-based products, be it consumer products, be it substances, new substances that are coming to the market, and slowly it will also involve some of the drugs and devices areas. Of course, the International Pharmaceutical Regulators Forum, IPRF, now is formalizing our initial group that used to be called International Regulators Nanotechnology Working Group. And the members that you see here today, of course, we increased our numbers, but the core group is still very much part of it, and we're building on it. And in conclusion, Health Canada feels that at this point it's too early to develop new regulations. However, we do need to develop some new methodologies, perhaps, and guidance for regulators and stakeholders, so it is easier to bring new products on the market. Thank you very much.
Thank you, Hripsime. The next speaker is also well known, is Frank Weicher.